This afternoon we are at the Agency for Health Quality and Assessment of Catalonia, AQUAS, the headquarters of the Health Department in Barcelona. We'll be explaining the evaluation work packages of this European Act on Dementia project. My name is Vicky Serra Saton. I'm a sociologist and expert in health services research. Have you ever considered what a joint action is for and if its products are robust and credible? We were familiar with the concept of evaluation and its applicability in the field of health services research and quality assessment. So what we've done in this joint action along the project has been to deepen in the concept of evaluation and its applicability in the fields of decision making and also dementia. Today we would like to explain you the three main points. First of all, the approach of evaluation. Second, the challenges and opportunities. And third, some lessons learned from these collaborations. AQUAS is a public institution linked to the health department and also the Catalan government. The mission of AQUAS is to generate knowledge for decision making in different key areas. The key topics are the assessment of healthcare system, research in healthcare quality, data analysis through big data, development of evidence tools for decision making, and then AQUAS also adds value in the field of innovation and participative strategies. We would like also to introduce other members of the team. Mireia Espallarga, she's a medical doctor, specialist in public health. She's the Director of Assessment and Quality Area at AQUAS. And also Gemma Cabré, she's a business manager and our Financial and Economical Officer at AQUAS.
I'm Maria Dolors Estrada. I'm a medical doctor, a specialist in public health. Today, we would like to share with you the approach we have used to evaluate the methodological quality of key products and how we have evaluated impact. To understand the evaluation of the methodological quality of Act on Dementia products, it is important to explain that the project is divided into phases. In the evidence phase, best practices were identified together with their benefits. In a second implementation phase, best practices were selected and tested in different pilots across Europe. These structures apply to the core areas for this joint action: diagnosis and post-diagnosis support, crisis and coordination, quality of residential care, and dementia-friendly communities. To evaluate the impact of the joint action, there was a first phase dedicated to define what impact was, and especially adapted to Act on Dementia joint action. It was agreed that impact of the joint action would be conceptualized as benefits, global achievements, and expected changes as a consequence of Act on Dementia. In a second phase, a conceptual framework for impact assessment of Act on Dementia was defined. This framework helped Work Package 3 to propose a list of measures to assess the impact of Act on Dementia in the future. In a third and last phase, a qualitative study with interviews to key informants was carried out to collect their opinion on their benefits and perceived changes as a consequence of this joint action.
The challenges and opportunities of the evaluation process within Act on Dementia have been learning, sharing, agreeing, and defining a tool for the assessment of methodological quality of Act on Dementia. We've been able to adapt this kind of tools and their criteria to potentiate and ensure that this process for the identification of best practices in the field of dementia were robust and also their selection based on the evidence. In Act on Dementia, we've learned more about these tools, and we have had the opportunity to collaborate with Trimbos Institute and take into consideration the criteria applied within the European Commission in the portal of best practices. We consider this learning process, and this practical application we've done has allowed to evaluate in a homogeneous way and establish what the methodological quality is through a score and also a threshold. We have been able to apply the health consensus tool. It has allowed generating collective intelligence around key topics and essential topics in the field of dementia, such as the improvement of tools for a correct diagnosis of dementia and other instruments to assess the needs of people living with dementia and their caregivers. And finally, the qualitative study has allowed to collect the voices of people directly more or less involved in the joint action from different disciplines about the perception of the benefits, learnings and achievements of this joint action.
The evaluation of the impact of a joint action is possible within the project, mainly to reach an agreement on the expected potential impact benefits to be measured in the future. These impacts should be promoted from the beginning of the project. To conclude, the evaluation of Act on Dementia has allowed promoting a methodological quality culture and also move forward in ways to measure their impact.